It's easy to get in a slump, especially in the months after Christmas when it's still dark and cold out. But I try to remember to celebrate what I have and what's in my power. It's easy to say, and yes, sometimes hard to do, but worth it, Dr. McGinn.
It is true. I think, especially after Christmas, we know from research that the winter months can be difficult for some. It can bring on seasonal affective symptoms or the disorder itself if you're vulnerable. It can heighten trauma. So I think doing something outside in the daytime is very critically important for people who are vulnerable. So the diminishing of light is what creates that vulnerability. So doing something every day outside if you're vulnerable is absolutely key.
John wants to join the conversation, especially talking about masks. He says, why does this politician feel so passionate about keeping masks in, or children in masks rather? We have data, we understand risk and the measures to take to mitigate such risk. Depression, anxiety, substance dependence, suicides, all on the rise. And still, she threatens funding for not putting unfitted masks on children. The reason our parents' cries grow louder by the day is because we see the results of these political games and power grabs manifesting in our children's cognitive, emotional, and social development suffering in real time. If one feels so strongly about it, mask up. But the time for our children to pay for your level of comfort has come and gone, Sherry.
Well, thank you for that information. That's a lot to unpack. And I certainly wouldn't even begin to start to express any of the thoughts that our politicians have. And we all have strong feelings about it. But the reality is, going back to where we started, it is a personal decision. Families have to make decisions that are comfortable for them. And going back and forth with our children and changing our mind isn't always the most helpful thing. So I appreciate those comments, but I do think it starts in the home and we have to do what we feel is safe for our children.
Ben saying, my wife is literally in tears over this. She's a teacher. She hasn't seen her students' faces in 2 years and her district just announced no masks. She can't wait to see her kids smile. Dr. McGinn.
I can certainly relate to that. I think that would be an enormously gratifying position for a teacher. I imagine other teachers might react differently with fear that their kids are not wearing masks. So I think the myriad emotions I think would go through teachers who have really been in the front line for this pandemic. I think they're dealing with not only changes in behavior, they're seeing changes in, a level of socialization, and they're worried about their own families as they go through this. So it's a lot for teachers to handle. And if that makes her happy, that's wonderful. I can only imagine how she feels.
Lisa says, my child will be wearing his mask. I don't trust others. I'm sorry, but some parents send their kids to school when they're sick. So then you see, the opposite side of that, Sherry.
Absolutely. And that goes back to having to do what you feel comfortable with. And I do appreciate the teacher's position. And if we remember at the very beginning of this pandemic, some caregivers in hospital settings were wearing their photos around their necks so that their patients can have a sense of who they're really dealing with. We can certainly apply simple tools like that in a classroom as well, that kids could wear a photo, but there are other things that we can do also to kind of make that connection with each other.